Greetings. Welcome to A Crohn's Disease Life. My name is Michael A. Weiss. I'm the host. The topic for today's show is teenage chronic illness. How to cope with it. So this podcast or video blog, whatever you want to call it, is targeted towards teens and also their parents, because a lot of times teens don't really want to participate in learning more about their chronic illness, and sometimes they're in denial, sometimes they're afraid. So a lot of times I get calls from parents, so that's why I'm addressing it to both. For those of you who haven't watched this before, as I said, my name is Michael Weiss, and I'm 47. I've had a chronic incurable autoimmune illness called Crohn's disease for about 25 years. Been hospitalized almost 200 times now. I've had about 15 or 16 major surgeries. I'm having another one December 13th. And I actually wrote a book about my experiences called Confessions of a Professional Hospital Patient. It's a funny but real account of what it's like to be a chronically ill patient, both in and out of the hospital. And I think it gives me credibility as somewhat of an expert in this area, unfortunately. And you can purchase the book at Amazon, Barnes & Noble, or on my site, which is hospitalpatient.com. So now for the matter at hand, and I'm just going to be kind of brief with just some basic guidelines to sort of think about when you get diagnosed or when your child gets diagnosed with a chronic illness. Let me first say that, with Crohn's disease, for example, it is a broad spectrum illness. So someone can have one flare-up and never hear from the illness again, or they could have many hospitalizations and surgeries like myself. And, a funny story which made me think of this topic for a podcast. I had a friend who was such a good friend to me while I was going through a horrible time with my Crohn's. I was hospitalized a lot. It was about 10 years or so ago, playing softball, and he used to come from the games, him and his wife, and they'd always visit me in the hospital. Well, 10 years later, I get a call. Hadn't heard from him in a while. I mean, we're still friends, just life. He had a couple of kids. I'm single, so our lives went in separate paths. And he called me up because his youngest son, who was maybe 8 at the time, was diagnosed with Crohn's disease, and he had a lot of questions. But really what he wanted to know, and I knew this when he called, he just didn't want to come out and say it. He was like, Michael, is my son's life going to be as crazy or as effed up as yours is? But he didn't want to come out and say it, so I immediately attacked the quote-unquote elephant in the room on the phone and said, hey man, just be cool. It's a broad spectrum illness. Your son's going to be really fine. He may never get sick again. And we reconnected a couple of months ago, and his son is doing fine, so I'm really happy about that. But keep that in mind, that whatever illness your child has, or even if you're a teen, a lot of these chronic illnesses, whether it's diabetes or a blood disorder or types of cancer, they have very broad spectrums, and also they're different from patient to patient. And I think a lot of that has to do, obviously, with the particular illness, but it also has to do with the mental attitude, how the person, the patient, the teen, the parent, how they approach it. So I'm going to try to approach it that way because that's helped me, and it's helped me advise other people, because I often get calls from parents. Hey, what do we do? My son's going to college. He's got to try a new medication for Crohn's disease. He doesn't want to. He's afraid. What does he tell potential girlfriends? When does he talk about it? There's a lot of issues that teens have to deal with that are very difficult when they have a chronic illness, and sometimes they feel uncomfortable coming to their parents or even to their doctor. So keep these things in mind, and I think it'll help you because it's helped other people. Number one, the diagnosis of a chronic illness, no matter what age, no matter what the illness, it does not define who you are. And if you're a teenager, let's say you're 15, you could be a tennis player, you could be a math major, you could be funny. But if you have, let's say, Crohn's disease, it's just another thing about you. It may take up a lot of time, and it may handicap things you can do or can't do, but it's just another thing. So who you are is a lot of things. And also, it's hard for teens to realize this, but when we age, when people are 30, that everybody's got something. So if you find out when you're 15 that you unfortunately have diabetes, it's a rough thing to handle. But if you take a step back, or if maybe you're 25 and you're looking back, you'll see that your friends, everyone gets something. When you get it at a younger age, it is tough, but I think it's actually, for me, it's been a good thing because it really makes you see things very clearly. It removes all the noise, all the BS in your life. Your friends become more genuine. You live more honestly. So, and I'm not trying to be Pollyannish about it, because how difficult it could be. You know, kids think that they're indestructible and they want to be able to do whatever they want to do. But life is complicated, and getting a chronic illness when you're young is an opportunity to grow. It's an opportunity to become tough. And I think when kids embrace that, they grow from it, and they become admired by their friends. So they become like a sought-after friend. At least that's what happened to me. So the other thing is, teens have to remember that whatever you cannot affect it. You cannot let it affect your relationships. What I mean by this, I could just explain this by a story. I had a girlfriend in law school. We were dating 3 or 4 years, and I was in the hospital a lot. And one time I said to her, you know, this Crohn's disease, it's going to destroy our relationship. I so appreciate what you're doing, but how much more can you put up with? And she said something to me that really made me grow up. She said to me, Michael, it's never going to be your Crohn's disease that affects us. It's how you handle your Crohn's disease that could affect us. And I knew exactly what she meant. And from that day forward, I realized I was in control. You know, how bad the illness infiltrated my life, or how much it infiltrated my life, or how much it handicapped me, was really up to me. Now, yeah, there are days where you got to lay on the couch, or if you have some other illness, there are days you can't eat certain foods, you can't participate in certain events. You just have to sort of digest it, smile, do other things. And if you manage your illness that way, I think you'll have great friends, people will admire you, and they'll see that you've learned one of life's greatest lessons, is that you have to look at things as an opportunity. No matter how bad they are, there's always an opportunity in everything. An opportunity to learn, an opportunity to grow, an opportunity to be a better friend, to be a better brother, a better sister, a better worker. So, and now with technology, no matter what kind of illness you have, you could work from home. So, you know, being handicapped or disabled is not as crippling as it once was. So keep that in mind as well. The third thing I wanted to say is, get out in front of it. This is a sort of phrase that professional public relations people use when, let's say, a celebrity has a crisis. They'll always say, get out in front of it. Let's say someone's caught doing a DWI, you know, driving while drinking, and, you know, rather than having other people report on it, they want you to come out and make a statement. I think it's the same thing with a chronic illness, particularly, let's say, if you're a teenager in high school. You don't want other kids knowing something about you and making them feel empowered with a secret that, ooh, I know that Jimmy has diabetes and I'm going to tell so-and-so. It's no big deal. And if you just tell people about it, it's no big deal. You diffuse it immediately. And I know it's petty, and you're not a petty person, I'm sure, and I'm not, but other people could be. And sometimes it's not them, it's just the fact that they're 15. So get out in front of it. Be honest. Tell people. You know, when it's appropriate, of course. And obviously what I mentioned before about dating and whatnot, that's sort of an art all unto itself, when to incorporate these other things about you. Because like I said before, your disease is just another characteristic about you. So, you know, would you bring up, I'm a great tennis player, in math on the first date? Maybe not. So why would you say I have Crohn's disease on the first date? Just incorporate it when you think it's appropriate. But in terms of the initial diagnosis, if, you know, get out in front of it. You know, don't be afraid of it. Own it. Own your diagnosis. I think that's really important, because it's who you are. Don't be embarrassed by it. Don't be afraid of it, and own it, because you're just going to learn and you're going to grow. Another thing is, slow down. Look around you. I think you need to look around at your friends and your family, and even articulate how much you care about them and how much you appreciate them, because you need to start developing relationships with people, whether it's family and friends, that will become your support team, and that will be able to withstand the challenges that your illness is going to cause over the years. I know mine has caused a tremendous amount of adversity, and if it wasn't for the support that I get from my friends and family, I don't know how I would be able to survive. And so if you slow down and look around you and really appreciate what a friend is. And on the flip side of that, what ends up happening is you see what other people do for you, and it makes you become a better friend, a better brother, a better student, a better basketball player. It sounds corny, but I'm talking from experience. I always thought I was a good friend. I try to treat people the way I want to be treated, and I think that's a great standard. But when I saw what people did for me when I got sick, I just upped the ante a bit and tried to be at the top of my game all the time whenever a friend needed something. And I think you need to do that. You need to form that so that you have a little bit of support going forward, because unfortunately you may need it. And it's good to have them anyways, because we all want genuine friendships. We all want people around us who want to be around us for who we are. And who you are, part of who you are, is this chronic illness. And the way you deal with it is, I think it is determinative of the kind of people who will be around you. All right? Lastly, there's a million things I could talk about, but for the purposes of this podcast, the last thing is, if you're a parent, find the right doctor for your child. And if you're a kid, when you meet the doctor, you need to communicate who you are, what your lifestyle is. Maybe you want a younger doctor, not an older doctor. What's their support team like? What are their approaches like? Are they a little too quick to prescribe radical medication? How many people your age have they treated with this illness? Whether you're a parent or the kid, these are questions you need to ask. Now, everyone always says, oh, I have the quote-unquote best doctor for you. And there's always the best, and it's always good to see 1, 2, or 3 people. But don't get caught up on that, because the quote-unquote best is not always the right doctor for your child. Because sometimes the doctor needs to understand a kid who's athletic, a kid who's going away to college, a kid who's adventurous, who maybe wants to go to Africa. What kind of medications do they need? Doctors would say, no way, don't go. Some would say, okay, let's try to figure out a treatment to accommodate you. And I think both parent and teen needs to understand that, so that they could find the right doctor. Again, they have to be good. No one knows who the best is, but the key phrase is right, and there are a lot of different characteristics, and just be honest with yourself of what you need in a doctor. And I think I've articulated that. So, lastly, depending upon your illness, if there's ever a need to be rushed to the hospital, like with Crohn's disease there could be, pack a knapsack. Keep one at school or at work, keep it in the car, keep one at home. Put things in there that you'd want in the hospital. God forbid you ever have to go there on short notice. And tell someone, your best friend, your parent, your mom, your whomever, your teacher, tell them where the knapsack is located. And that way, I think you get some confidence to know that God forbid something happens, at least in that knapsack are things that you need if you were going to be in the hospital. It could be as silly as your favorite shampoo or a pair of slippers or books to read or whatever. But your medications obviously would be the most important thing. A list of your medications should be in the knapsack as well. It's very, very important. And this is the best way to sort of deal with chronic illness, because you can't control so many things about it that you might as well try to control what you can. So I hope these tips, have helped you sort of grasp at least how I've handled chronic illness, and I think it should make your lifestyle better. So if you have any questions, please feel free to contact me at michaelweiss@hospitalpatient.com. The book again, Confessions of a Professional Hospital Patient, and please feel free to subscribe to this YouTube podcast or tell your friends about it, and I'd love to cover other topics that you may be interested in, so please feel free to email me about them. And also on Twitter, you could follow me. My name on Twitter is Hospital Patient. So thank you for your time, and good health to all. Thanks.